Hi guys, Margot here from Rapid Fitness, and today I'm going to talk about pregnancy myths and exercising. Now before I get started, here's a disclaimer that I am only a personal trainer certified in pregnant and postpartum fitness. So before you start exercising or going to classes or starting to become active, make sure that you get your okay from your doctor, OBGYN, or midwife. Myth number one is that lifting weights is dangerous for you and your baby. As long as you get the okay from the doctor, that couldn't be further from the truth. Lifting weights and exercising while pregnant is going to make you feel fantastic. And recent studies have shown that women who work out throughout their entire pregnancy have shorter, safer labor and deliveries, a shorter recovery time, shorter stays in the hospital, and a decreased risk of complications in the labor and delivery room. Myth number two is that lifting weights can increase your pregnancy pains and can also injure yourself. It is true that when you are pregnant, your body is more unstable than when you're not pregnant, but this is because your body goes through hormonal changes and you have an increase of a hormone called relaxin, and it does exactly what you think it does. It relaxes your ligaments and your tendons, which does make you unstable. However, lifting weights and strength training, it increases your stability. A properly planned strength training program will decrease the aches and the pains of normal pregnancies, but it can also increase your stability with your muscles in your core. Because when you're pregnant, you have a ton of weight in the front of your body. And so it's super common for women to carry that weight in the front where they arch their back and their back almost makes a C shape. And that causes some low back and upper back pains. And so as long as we strengthen our muscles and focus on our core, we're able to have common alignment. So we want our spine to be in a straight line. So strength training also helps our stability with our muscles all over, in addition to our core. And this brings us to our myth number three. Our third myth is that you are supposed to stop training your abs because you're gonna risk ab separation or separation of the abdominal wall. I have had so many people tell me to stop exercising my abs because I am going to split my abs apart. However, having a nice, strong core during pregnancy keeps that alignment that I was talking about earlier, and it can help decrease your typical pains of pregnancy. Now, abdominal separation is a real thing, and it is called diastasis recti, or DR, and this is because as you're pregnant, that weight is being carried in your, obviously the front of your body, and so that puts a ton of pressure on your abdomen, where we are stretching our abdominal wall, and that can make the tissue separating the abs very thin and very soft. So actually, working our core while pregnant can decrease the risk of having diastasis recti after you have your baby. And the last myth I'm going to talk to you about today is the myth that walking and yoga are the only two exercises that you can do while pregnant. Now, I love to go on walks with my family, and I love going to yoga class because it just really helps my mental health, but those are not the only two things that you can do to exercise while pregnant. There are so many benefits to strength training and lifting weights while pregnant that often parallel with the benefits even if you're not pregnant. During pregnancy, your body changes a ton, and so as your body changes, so should your strength training program. And so your strength training program should support your ever-changing body in the journey of pregnancy. You can also maintain your strength as you carry extra weight from the baby. Strength training can also help your postpartum recovery process, and it can actually shorten the amount of time that it takes to recover from having your baby. Working out while pregnant also helps you prepare for the intense labor and delivery of your baby. It's really important to remember that if you exercise in your first trimester of pregnancy, it is going to look very different from your third trimester of pregnancy. And that is because your body is changing and your body is growing. So modifications, less weight, less reps, or maybe it's less weight and more reps, or just the decrease of difficulty, that is normal and that is expected and that is okay while you are exercising during pregnancy. So that's all I have for my myth video. If you have any suggestions of more videos or content that you want to see, drop it in the comment box below. Like our video, share our video. Thank you so much, and we'll see you guys next time. Bye.